All right, the Associated Press calling Medicaid's health overhaul's early success story. Look at that headline. But how could you call it a success story when 440,000 people have been added to Medicaid and only 50,000 people have enrolled in private plans? How does that make a success story? Stuart Varney's here. Stuart, this seems like a reach.
It's a stretch by any imagination. How can you call it a success when basically you've introduced a huge new entitlement program with runaway costs, which you cannot afford, and when you cannot already reform the entitlement programs you've already got? Because that's what this is. 440,000 people signed up for Medicaid. They bypassed the non-functioning exchanges, signed up for Medicaid in just 6 weeks in just 10 states. Altogether, 9 million extra people will sign up for Medicaid when this is all done, and that's got to be paid for. Initially, it's paid for by Washington, national, federal taxpayers. Eventually, some of the cost will pass to the states. But essentially, this is a gigantic new entitlement program with runaway costs. I don't call that a success.
So when people sign up for a free program to get free access, that is not considered, I don't think, on anyone's ledger a success story. It's amazing how the AP seems to be reaching for this story,
well, look,
when others like the Washington Post, who always cheer for Obama, have jumped off the bandwagon.
Well, let's call it for what it is. I mean, 9 million people will eventually get health care coverage. And that, I suppose you could say, that is a good thing. They don't have coverage now. They're going to get coverage. But we're forgetting the cost here. There is runaway cost with this new entitlement program. We don't have the money. It's not being funded by Obamacare. Who's going to pay? And when the bill finally comes in, how big will that be? We don't know.
And for another time, just wait for those subsidies to come in for all those people that lost their health care plan. President Obama's going to come through with subsidies. More money that we don't have on a program we can't afford when we were told it's going to be deficit neutral.
Those people who have to pay for coverage are not signing up. Those who get it for free are signing up in droves. That's not a success.
Stuart Varney, 9:20, you're going to be bringing your show.
Yes,
if you're a cable subscriber, we get you at 9:20. We'll see you there.
Yeah, thank you very much.
All right, Varney and Company.
Thanks.
Meanwhile,